So I'm just gonna have to ask you some basic questions today. Oh, just 1 minute, okay. I'll just be right with you. Hi, I'm so glad you could make it. You're the intern that's gonna sit in today, right? Okay, well, you're here on perfect timing. My patient's here. I just got to do some prep work, ask him a couple questions, and then we're gonna get started on his cranial nerve exam. Okay, and you can just sit back today and take notes, okay? Don't worry about performing any of these experiments, okay? Alright. Okay, so back to our questions. You already seen the nurse, so she already got your name and your birthday. Okay. Looks like she already got your phone number and your email. Okay, so it looks like you're all set. The paperwork. Okay. Let's see. Alright, so have you ever had a cranial nerve exam before?
Mm-mm.
No, you haven't? Okay. Alright. So, before we get started, I just want to be very thorough with you on what we're going to be doing today. A cranial nerve exam is something that we like to take our time doing. So, you're going to be sitting here for quite a while, so just get comfortable. I'm going to perform a variety of tests on you, okay? Test all your symptoms, or your senses. See if you have any symptoms for anything going around lately, stuff like that. Make sure you're all healthy. So we're going to start with your feeling, okay? I'm going to perform different series of tests on you for your feeling. Then we're going to move on to your sight, okay? Have you had a vision test in the last 6 months?
Mm-mm.
No, okay. And just making sure that we have all of your paperwork. Okay, so after we do your sight tests, we're going to move on to your sense of smell. And we are going to then check your ears, your hearing. We're probably going to perform a guess the sound type of test, okay? Is that going to be okay with you?
Mm-hmm.
Okay. And then last but not least, we're going to test your tasting ability, okay? Is there any foods that you may be allergic to, or any smells, or any medicine, or anything like that? Okay. No allergies. Let me just fill this out really quickly. Okay, do you have any questions about the cranial nerve exam before we begin? Okay, so just sit back and relax. I'm going to do some sanitation and some prep work really quickly, and then we're going to go ahead and begin your cranial nerve exam, okay? Alright. So, the first thing that we want to do when we do the cranial nerve exam is just make sure our hands are clean, our hair is put back, anything like that, just to keep it out of the patient's way, keep it out of our way as well. Okay. So I'm just using some disposable gloves, and if you ever run out of your own supply, there are various boxes around the whole hospital. You can find them in every room, almost. So, not every cranial nerve exam calls for a surgical mask, but since we are doing a full, up-close, intense, personal cranial nerve exam, I'm going to wear one today. properly. Okay. All right. Okay, so before I start on the senses, I'm just going to check your blood pressure and do a couple simple tests to begin the exam. Okay. So I'm just going to have you relax and let's see. All right, and just sit up straight for me and take a deep breath in and out. Okay, and again. Okay. Just going to test the back. Okay, and again. Okay. Right. Let's see, just gonna check your glands here. Do you feel any pain when I put pressure under there? Okay. And what about in your face?
No.
No pain or soreness. Okay. All right. And I'm just going to look in your mouth. Okay. Good. Okay. And we're just going to take a little sample of your saliva just so we can send it back to our labs. Tested. Okay. All right. Doing very good so far. Now let me just take your blood pressure. I know the nurse took it already, but I just want to take it again. I'm just going to slide this on your arm here. Is that comfortable? All right. Now just relax your arm. Alright, so your blood pressure looked good. Your glands and your throat looked good. Okay. And the nurse took your temperature already, and that looked good too. So, alright, we should be able to begin our series of tests for your feeling portion. I'll start by just having you hold out both of your hands for me. Go ahead and just hold out both your fingers, okay? Now, I'm just going to give a little pinch to each tip of your fingers. Let me know if you can feel that. Yes? Okay. Did you feel all those?
Mm-hmm.
Okay, go ahead and close your eyes and leave your hands up for me. Go ahead and keep your eyes closed. Now, I'm going to just touch one of your fingers, and after I do, I want you to just wiggle your finger a little bit. Great. Okay. Very good. Okay. Go ahead and put your hands down. And I'm going to go ahead and test a couple different temperatures on you. Is that going to be okay?
Mm-hmm.
All right, go ahead and just relax. Okay. Okay, now I must remind you, some of these temperatures are a little cold, okay, and some of them are a little warmer than others, but nothing to be alarmed about, okay? I just want your first reaction. Just let me know if you feel hot or cold, okay?
Mm-hmm.
I'm gonna go ahead and apply it right here.
Cold.
Okay, cold, good. Okay, I'm gonna apply it on the same cheek.
Cold.
Good. Okay.
Not sure.
Okay.
Cold.
Okay, good. And what about this last one?
Cold.
Okay, good. Okay, now for this next part, I want you to keep your eyes closed. I'm just going to use this feather to gently run along one of the sides of your faces, okay? Now I just want you to say left or right whenever you feel it on one side, okay? So just keep your eyes closed for me.
Right.
Okay,
Right.
okay,
Left.
good job,
Left.
good job.
Left. Right.
Great. Okay. So I'm just going to make a couple notes on your feeling tests. Did a really good job. Okay. The next test we're going to do is on your sight. Alright, so we're just gonna have you read a couple of the letters on this sign, okay? Do you usually wear glasses normally every day? Okay. Alright, so I'm just gonna point to a letter or a number, and I want you to just read that one letter to me or number. Okay.
Okay. C.
Okay.
P.
Good job.
L.
Okay, great. I'm just gonna hold it a little farther back, okay?
Okay.
Right. This one.
F.
Good job.
D. 11.
Great. Okay. Now I'm gonna just hold one eye. I'm gonna cover one eye, and I want you to read the whole line here, okay?
Okay. L. P. E. D.
Great. Okay. I'm gonna hold the other eye, and I want you to go ahead and read this whole bottom line right down here, okay?
Okay. L. E. F. O. D. P. C. T.
Okay, good job. Great. Were any of those hard to make out for you? Okay. Alright, just 1 second. Okay. How long have you worn glasses?
My whole life.
Okay. Have you had to upgrade them much, or have they,
They changed the prescription on them, and...
Okay, so your prescription's changed mildly, you would say. All right. Okay. I'm gonna go ahead and take off your glasses. Okay. Alright, let's just have a look at them. Okay, just one second. So when we see a patient that needs glasses repair, we offer them a free glasses consultation just straight away, just telling you that for future references. So I'm just going to put these right over there. So yeah, anytime you see a broken pair of glasses or glasses that need adjusted or anything, just keep an eye out for that. Okay. So I'm gonna put these tinted glasses on you and just do a couple light tests. Okay, is those comfortable? Okay, great. So first, I'm just gonna have you simply follow the light. Okay, I'm just gonna hold it back. Not that much. Okay. Great. Alright, now I want you to look at my fingers. Okay, keep looking at them. Okay. Okay, great. Okay, now I'm just going to get a real close-up look at your eyes here. Just hold really still for me, okay? You're doing great. Doing really good. Okay. Wonderful. Okay. And this is our strongest light source here, so I'm just going to take a deeper look, get a little bit closer, okay? But at this time, I want you to look up, just tilt your head up just a little bit, okay? Okay, 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 and look up to the ceiling. Okay. Just one moment. Let me make a couple notes with that. Okay, we're not done with your vision test quite yet. I want to do a couple other experiments. Okay. So have you ever had a vision test done before? Okay. Or, I'm sorry, a color test done before. Have you ever had a color vision test done? Okay. It's quite simple. I'm just going to hold up a color. You're going to tell me what it is, okay?
Orange.
Great.
Red.
Okay. Now I'm just going to cover one of your eyes and you're going to tell me what color.
Light blue.
Light blue, good job. And that was with the tinted glasses on, so that is very good. Okay. I'm going to go ahead and take these off of you now. Okay. And we're going to go ahead and put your glasses back on you. And if you do want to see the eye doctor, if you do want to see your eye doctor after this appointment, or if you want to make an appointment with her, you can do so with the nurse. I'll just have to remind her for you. Okay, so you did really good on your color exam. Now we can move on to smell. Okay. Alright, so I'm going to hold up a variety of different smells to you, and you're just going to tell me what smell comes to mind. This is actually one of our most important senses, so just be very honest and take your time. Now, these different jars are colorful, but they only do this to kind of trick the brain. So if you see something that is green, you might think that it's a minty smell, but it could also be tricking you at the same time. So I'm just going to kind of waft this to you and just tell me what the first smell comes to mind.
Cotton candy.
Cotton candy, okay. I have to just record your answers. Okay, this second jar, I'm just gonna kind of put it close to your nose. And what would you say that scent is? Take your time, it's okay. Just take your time and relax. What do you think that is?
Grape.
Grape, okay. Very, very good. Okay. This one's a little tricky. This one is brand new as well. So just okay. Go ahead and take a smell. Take a whiff of this. What would you say this would be?
Lemon lime.
Okay. Okay. We have just a couple more here. What would you say this would be?
Banana.
Banana. Okay, good. Okay, and the fifth jar of scent that we have is right here. Good. Okay.
Kind of like a candle.
So like wax.
Yeah, like wax.
Okay, just an original scented wax. Very good. Those were very specific answers. Okay, so good job on that. You can go ahead and open your eyes if you'd like to. If you're relaxed and you want to shut your eyes, that's fine too. I'm just gonna record that last answer you gave me. What was that answer? Wax. Okay. Just original scented wax and original scented wax. Okay. Great. So your smell test was great. We have two more senses to get to today. We have your ears, which I'm going to check next. And then we have your taste, okay? So, for your ears, just grab a tool. Okay? Just going to look inside them. So go ahead and look towards the curtains for me. Okay. Just see here. Okay, good. And let me see this other one here. Okay. Do you have any pain in your ears? Any itchiness? Any,
No.
okay. And when I touch them, do you feel any pain, soreness?
No.
Okay, good. Good. So, since I'm not seeing any redness or irritation with your ears, we can go ahead and move on with the next set of tests. So I'm going to do a sound assortment to kind of have you guess what the sound is, okay?
Okay.
Okay. So I'm going to go ahead and have you close your eyes again. I'm just going to do different sounds on each side of your ears and try to guess what sound I'm doing, or what the closest sound is that it would be, okay?
A glove?
A glove. Okay. Any other object I might be using?
Bubble wrap?
Okay. Or some sort of paper or substance. Some
Yeah, kind of like a paper.
crinkly paper. Okay, good. Okay. What is this sound here?
Flashlight?
Okay. Or like a button.
Like a button.
Okay, good.
Cardboard?
Okay. Or like a card of some sort. Good, very good. Okay.
Water.
Good job. All right. So you did very good on your sounds. So now I'm just going to make a sound in one ear, and I want you to just raise the hand on the same side that I'm making the sound in your ear, okay?
Okay.
Okay. Okay, good job. Okay, very good job. Very good. Alright, so you can just relax. We just have one more series of tests to go over. Let me just make a couple notes by your hearing tests. Okay. You doing okay? You're doing okay? Alright, perfect. Alright, and it looks like we just have the taste tests, which is everyone's favorite. So, just to ask you a couple questions before we begin. You said you weren't allergic to anything. Do you have any numbness ever to your tongue or anything? Okay. And how is your taste usually? Do you think you have very vivid taste, or does a lot of foods kind of taste bland to you?
Vivid.
Vivid, okay, very good. And let's see, I'm gonna ask you a couple kind of personal questions, just kind of what's your preference? Do you like bitter tastes?
No.
Okay. Okay, so how about sweet tastes?
Yeah.
Okay, sour?
Yeah.
Okay, and how about like spicy tastes? Do you like spicy foods?
Kind of.
Okay, alright. So, everything today we have is not spicy or bitter or anything. It might be a little sour or sweet, though. Is that going to be okay? Okay, great. Just close your eyes. Good job. Okay, and go ahead and open your mouth. I'm just going to have you bite down on a little tiny bite of that. And take your time. You can really take this time to absorb the taste, okay? Tell me what you think it is.
Grape.
Good job. Great. And the same thing with this, whenever you're ready, if you need a drink of water to kind of clear your taste, just let me know. You're ready to move on? Okay, and just bite down a little bit.
Banana.
Oh, he knew that one right away. That's really good. Okay. Right, and this next one is the same exact thing whenever you're ready.
Strawberry.
Okay, alright, let me just make a note. You did get that one wrong, but that is perfectly okay. Okay. So, just for you to know, that was sour apple, okay? Sour green apple, but that's okay because sometimes when you are tasting all these different tastes, you can kind of confuse things a little bit. Okay, go ahead and taste this one. Take your time on that.
Orange.
No, that one was strawberry, but that's okay. All right. So, it looks like we are all done with the test. I'm just gonna make a couple quick little notes. Alright. Did you have any questions for me today about your cranial nerve exam? Okay. Let me see here. So you almost got a perfect score if it wasn't for the two tastes that you got. That's okay though. Just now, if you wanted to come in and retake that portion, just that portion of the test, we can get you scheduled for that. And by the way, did you want me to schedule you in for an eye appointment so that you can get that looked at?
I already have an eye appointment.
Okay, great. And is that with your primary doctor?
Yes.
Okay. All right. Well, it looks like we got everything figured out and taken care of. Thank you so much for coming and seeing me today. I hope everything gets sorted out with your eye appointment, your glasses there. So, okay. All right. And that's how it's done. So thank you so much for sitting in and watching his cranial nerve exam. Okay? I hope you learned a lot. All right. I'll talk to you both soon.